South African epidemiologists are discouraging a blanket ban on travellers from India as that country battles to control an outbreak of COVID-19. They say it would be more effective to impose a quarantine on travellers. Concerns of a third wave have been fueled by fears of the variant first detected in India, but Health Minister Dr. Willem Kize assuring South Africans that the variant has not been identified in South Africa. Now, Professor Thumi Ndungú is the Deputy Director at the Africa Health Research Institute, and he joins us now live. Prof, it's great to have you with us this morning on the show on what has been a story that has been getting various inputs from various quarters, and I think some of the panic that's associated with the pandemic here at home as we now gear up for fears of a third wave of infections. If we talk about people traveling from India, much of what the public is saying is close our borders. What do you reckon?
Well, thank you very much, Michelle, and good morning to you and to the viewers. I think it's a fairly complex issue, but my view is that it will be much more efficient to quarantine people that are coming from India rather than have a complete ban of travel from India. And the reason for that is that, first of all, these mutations, these new variants of the virus seem to be emerging from anywhere in the world. As long as the virus is circulating within the population, the chances that you're going to have a mutant appear and begin to take over the epidemic are quite high. And so I don't think that a total ban is necessarily the solution. I think it should be a matter of more identifying people that are coming from India, maybe placing them under quarantine, and us then continuing to do surveillance because we shouldn't rest on our laurels. It's quite possible that new variants could emerge even here in South Africa itself, even when, as long as we have the virus still circulating within the population.
Prof, let me ask you this issue around new variants being detected in countries that already have variants of their own. What does that mean, if anything at all, for the trajectory of the virus in South Africa?
I think it means that we have to be extremely vigilant and continue to have genomic surveillance, because what it means is that there is a degree of unpredictability as to how the virus is transmitting, as well as how it is mutating. This is a new virus. Obviously, it entered the human population less than 2 years ago, less than 1.5 years ago. And so there's still quite a bit of unknown about how the virus is actually evolving and how it changes over time. And we have to be very vigilant about that and know that even here in South Africa, there is no guarantee that there will not be new variants emerging. And so because of the fact that some of these new variants might either transmit more easily or become resistant to vaccines, for example, or to immune responses within the population, it is absolutely important that we keep track of what is going on so that we can either develop new vaccines that will be able to counter these variants as they emerge. But I think more importantly, it is very important that we should try and vaccinate people as quickly as possible, because the only way to actually stop variants from emerging within a population is to reduce transmission of the virus. And the only sure way to do that at the moment is through vaccination. And certainly it is the most efficient way to reduce transmission within a population.
So, Prof, you've mentioned the phrase genomic surveillance amid the COVID-19 pandemic. Why is it such a powerful tool when it comes to not only gauging the trajectory of a virus, but also government's response?
I think it's very important because it gives us data and sometimes in real time, or as close as possible to real time, about which variants are emerging in which places. And geneticists can then analyze that data and tell us whether this virus is in the transmission dynamics. In other words, is this virus, for example, being transmitted from one region to another? You can very easily be able to track that if you have genomic surveillance, because there are certain patterns within the virus that you can identify that then tell you that this virus is the one that was identified in, for example, in the Eastern Cape, and it has now moved to the Western Cape. So it not only tells you how many cases of the virus you have, but actually where the virus is originating from. And I think also more importantly for vaccines is the fact that we now know that some of these variants might be resistant to immune responses. And again, it tells us and it tells the government about whether the likelihood that these new variants that are emerging are likely to be resistant to vaccines or whether they'll be susceptible to vaccines, which is extremely important for us to in deploying these control measures. So for disease control measures to be rational and effective, we need to know actually what is happening at the genomic level to the virus. So I think that genomic surveillance is an extremely important tool that we need to employ in order to understand how the virus is transmitting, but also to come up with the strategies, novel strategies for prevention of transmission of the virus within the population.
So, Prof, I'm going to ask you a very layperson's question now, as a journalist and someone who's not a scientist. So, are you saying that genomic surveillance also helps us to track provincial travel, provincial transmission of the virus? Is that what you're saying? Or is it more an international picture?
No, that's correct. I mean, even within South Africa, using genomic surveillance tools, one is able to tell even whether the virus is, how the virus is spreading between provinces, for example, or even between localities, between hotspots. So it's an extremely powerful tool when employed to track where the virus is coming from, where the origin of the virus is, and how it is moving from one region to another. Extremely important. And as I said, for disease control measures, both in terms of quarantine, both in terms of restriction of travel, and even for the employment of vaccines, deployment of vaccines, a very extremely important tool to do that.
I want to ask you a follow-up question on the travel of the virus between provinces here in South Africa, Prof. So are you saying that various provinces would have slightly differing, I don't want to say variants, but slightly differing viruses in South Africa?
That's possible. What is happening in general with the virus is that the virus, because it has recently entered the human population, in order for it to survive in the human population, it will acquire a mutation. Yeah. And that mutation may become advantageous. It may acquire mutations that are disadvantageous to the virus, in which case that virus may die out. But by chance, it may also acquire a mutation that is advantageous to the virus. And when that happens, that's when you see a new variant beginning to emerge within the population. And that's when you see that particular variant, if it is advantageous to the virus, to its spread, and to the evasion of the immune responses, you begin to see that variant now taking over within the population. So when you use genomic surveillance tools, you're able to see whether, for example, if there was a third wave, hypothetically, whether that third wave is being caused by the virus that pre-existed during the second wave, or whether this is a new variant that has now arisen and began spreading much faster. And you can track and start to see the number of cases of this new variant increasing in a particular region. And this is why I'm saying it's a very useful tool that tells you, is it the same old variant that is now beginning to transmit again? Or is this a new variant that has emerged? And how has it moved from one place to another? So, yes, there are small differences from place to place, and this helps us to identify how the virus is spreading and transmitting within the population. That's
very interesting indeed, Prof. I mean, you talked about disease control measures and how genomic surveillance also assists very importantly in that regard. That's all good and well, but what about the vaccines? I mean, that's going to change the picture in South Africa, isn't it? When our vaccine rollout plan really ramps up and we hit those targets of 250,000 to 300,000 people being vaccinated a day.
In my view, this is the most important contribution, actually, of genomic surveillance. because it informs vaccine development, and it informs vaccine rollout. So, because there's no need, for example, to roll out vaccines that don't work against variants that may be present in a particular locality. So I think it's very important that we are able to track the emergence of new variants, but most importantly, to see whether these variants are actually susceptible or can be inhibited, can be suppressed by the vaccine, by the immune responses that are elicited by vaccines. And what we have seen so far, luckily, is that for the most part, the variants that are there in South Africa, here in South Africa, most of the vaccines that are out there now can have been shown to work against these variants. So that's very good news, and it gives us some hope that through vaccination, actually, we can overcome this pandemic. But we have to remain extremely vigilant so that we don't have new variants emerging that are resistant to these vaccines. And the only way to do that, really, is to vaccinate people as quickly as possible, to have a very quick rollout of vaccination, because as long as the virus is not replicating within the population, then it means that you don't have these new variants emerging. So the faster we vaccinate the population, the better we get ahead of the curve and prevent the emergence of new variants that could be very problematic for vaccine.
Yeah, absolutely. And given what you've just said, the last 2 days, again, we're seeing a spike in infections in a number of provinces, over 2,000 new cases reported for 2 consecutive days now. I mean, that's what you were just talking about. We don't want to see the virus replicating in the population again.
Exactly right. And I think it's very concerning that we are beginning to see an uptick in the number of new infections. I think the question that immediately comes to mind is whether this is the same old variant that was there, that was responsible for the second wave, or whether this is a new variant. These are questions that need to be answered extremely quickly so that we know how to deal with the emerging situation. But like I said, I just want to emphasize again, the faster that we can have our government and all agencies move towards vaccinating the population, the faster we will be able to, and the better we will do in terms of preventing this, both the surge in new infections, but also any new variants arising.
Absolutely. 17th of May, that's when government says phase 2 of the vaccination program gets underway. Professor Thumi Ndungú, thanks so much for your time this morning on the AM Report. He's the Deputy Director of the Africa Health Research Institute, as we continue to unpack the various issues arising in the COVID-19 pandemic, some of them specific to South Africa.